what really personally was also tough to comprehend was why are we still addressing breast cancer and actually the state of breast health in a sense to very, very invasive methods. So basically still the golden standard is just to cut the breast open and see what's going on. There's really no other way to just be able to tell what's going on. And even mammograms, women's breasts are being squished. Why are we still doing it this way in today's world? I mean, if you told a man that their organ would be squished for a health procedure, how would they react to that? Maybe I'm being a little bit controversial here, but I don't think it should be done in such a way.
Welcome back to Biohacking Eve, Health Optimization for Women with Judith Mueller, where we shine a light on everything that will help you reach your best self as a woman, as unique and individual as only you can be. Live long and prosper, my friend. Hello and welcome back, everyone. Today we have Nika Pintar of AniBiome on the show. Hello, Nika.
Hi, Judith. It's such a pleasure to be here today.
So Nika and I met, and when we first talked about things, we talked about the fact that women are biochemically a different person every single week. When I mean biochemically, I mean hormonally. And Nika made a very good point that the gut microbiome, which is one thing that she deals with on a daily basis, is actually heavily affected by hormones. Tell us about that.
During the longevity week. And it's so important to place women at the center of this understanding, scientific exploration of what is the female biochemistry like. And I think it expands much further than just the gut microbiome. So at Ani, we are pioneering the field of affective neuroimmunology. When I say affective, I am referring to the affectome, which is basically how do our emotion, thought, behavior, so all of the intangible things, the mind, how do they drive biological changes related to aging? For example, there are studies showing that, for example, people who will develop chronic diseases before that, they are showing symptoms of anxiety and depression and so on. So how can our mind drive such biological changes? And then how does that connect to the neuroimmunology? So our cognitive performance, how present we are, how focused we are, how much energy do we have, and what is our immune state? And when we are talking about the immune state, we must take into account gut microbiome. Finally, gut dysbiosis has been recognized as one of the hallmarks of aging. However, it's a much broader field. It's about completely mapping the state of both health and disease, because ultimately, if we don't understand each one separately, if we don't understand what health is, we don't know how to navigate from a state of a certain condition back towards the state of health. And ultimately here, a point that I would like to address as well is that we don't know enough about health. The whole system nowadays is really built around disease. So everything we are looking at, how the typical pharma approach is single molecule, single pathway related to a certain condition and so on. But no one is really looking at the state of health and what is the next stage in the state of health and how do we achieve it as humanity? Because when we look at numbers, only 1 in 10 Americans is considered metabolically healthy. So if only 1 is considered metabolically healthy, ultimately the question is that person really healthy, or are they only healthier than someone who is already suffering from something? And then there's so much room to explore in that field.
So tell us about exploration. You mentioned you went to a very interesting conference in San Francisco a couple of weeks back. And if you can maybe link that to the work that you're doing on breast cancer diagnostics, for example.
Yes, so I've been to the Rise Up Summit in San Francisco just recently, which is focused on women's health, specifically breast cancer. Dr. Laura Serman, who is really an outstanding woman, organized it with her team. They're doing the Wisdom study, which is focused on early detection of breast cancer. And what was really great to see was the amount of interest. The room was full, so much scientists, innovators, investors, everyone was there, which was absolutely outstanding. People from, A16Z, it was just the highest level. However, what really mm, personally was also tough to comprehend was why are we still addressing breast cancer and actually the state of breast health in a sense to very, very invasive methods. So basically still the golden standard is just to cut the breast open see what's going on. There's really no other way to just be able to tell what's going on. And even mammographs, women's breasts are being squished. Why are we still doing it this way in today's world? I mean, if you told a man that their organ would be squished for a health procedure, how would they react to that? Maybe I'm being a little bit controversial here, but I don't think it should be done in such a way. So connecting it to what we are doing at Ani, we developed our digital biomarker. And in that sense, the utilization of our technology can also be for early detection of breast cancer. It's based on oral immunology. We connected with neuroophthalmology and furthermore with cognitive biopsychology. Those are the subcomponents of our digital biomarker. And basically, there are numerous signs occurring at the level specifically of the oral cavity that show an indication that a woman could have breast cancer. So I would like to have a full-on disclaimer. We cannot clinically validated it yet. We are looking for partners to validate it. So not just partners in terms of clinical centers, scientists, and so on, but also for women who would like to be a part of this, who can contribute to the development of science and technology for early detection that is completely non-invasive. And ultimately, not just about early detection, but possibly even about looking at the individual disease trajectory and looking at which and how can be implanted on the individual level. Because when we are talking about women's health, we just don't know enough. Not enough funding is going into it. Only 2% of all venture capital going towards health-related ventures goes into women's health. That's 2%. And when we even zoom out, it's just I mean, we make up 50% of the world's population, right? We don't know enough. We need larger data sets. We need women to also be a part of it. So I would really like to use this opportunity to provide Ani as a platform as well. In terms of the early detection of breast cancer, we offer it for, free of charge. It's just about bringing this scientific novelty into real world application and helping humanity, because if we are able to do that, it's just outstanding.
Tell us about the thinking behind the link between the oral cavity and breast cancer. Does it go one way? Does it go both ways? What are the links exactly?
So when we are talking about oral cavity in general, there is so much we can tell from it. And it's not even just breast cancer. There are indications for gastric cancer, for IBD flares. So there's a lot of immunological markers that are occurring on the level of our oral cavity. For example, in IBD, it is well known that there are certain changes occurring in the region of actually on the tongue itself, like the color and similar, that correlate with acute state of inflammation. And those symptoms usually even occur prior to any other symptom we are able to look at on the level of the GI tract. So which one was first, the chicken or the egg? I don't think that's really the right question we should be asking, but rather, what can we do to observe it on the individual level to understand and predict before it occurs? And what is it that we need to provide that person specifically, whether it's a woman or a man, whether it's a child, because unfortunately in IBD, there's a lot of cases being diagnosed very early on in someone's life. And when you think about it, it's severely impacting one's quality of life. So someone will go on to live, for example, for three-fourths of their lifetime with a severely decreased quality of life. So those changes occurring on the level of the oral cavity, the tongue itself is one of the earliest diagnostics tools across a variety of different traditional medicines, but also Western medicine. We were a part of a program by EIT Health and Takeda, which is, the company for IBD, for specifically for non-invasive diagnostics based on tongue biomarkers for early detection of IBD flares. And yeah, it was really wonderful to be a part of this program. However, we have progressed much further since then. Also developed a multi-agent system so now our agents are talking between each other to really elucidate on an individual level what could each pattern tell us, and especially observing it longitudinally over time.
What's an agent in this case?
So when we're talking about agents, it's not a person doing all of these discussion. It's a machine learning agent, and basically it's gathering all of those vast data sets. Because you can just imagine it. For example, when we are talking about the oral cavity, we are talking about taking a photo of the oral cavity on a daily level. So we have the RGB camera taking a photo through the phone. However, we also developed a multispectral device, and we get infinitely more data because we are able to observe more spectrum than you can actually observe through a regular RGB camera. And then when we are looking at those spectrum, it's not even just about each individual, but actually the correlations between them. And then again, on the individual level, what is the standard and what is the deviation? So it's about observing and truly bringing N of one medicine in a digital scalable way that can be implemented anywhere. Usually for a multispectral camera, you would need to invest 15,000. It's a large device. It's not something you can have available anywhere. This you can bring with you anywhere you go. I bring it with me all the time. And yeah, that's a part of our proprietary diagnostics technology that we developed at Army.
So when you say it's about the mean, the average for the individual and the standard deviation for the individual, does that mean you should determine a baseline as early as you can in your life so you know what the variance is?
Exactly. I would argue that the earlier we start tracking and building, let's call it a digital twin, simply because that's the most, let's say, used term of ourselves, we can understand our youth better. We can understand our optimal state of health better. And because we know that with aging, degradation is happening. As we are talking, Judith, you and me are aging. We can't do
I'm
anything
not.
about it, right? That's in the field of aging, and we are all patients, right? All of those changes are occurring all the time, and nothing we can do about it right now. Anyway, so the earlier we start building such a digital twin, the earlier we start understanding on the individual level what is occurring, the more we are able then to understand as the technology is progressing what we need to do for that specific person. Because, for example, a lot of the standards nowadays in the healthcare systems were built on older generations, older populations. When we are looking at, for example, different cancer markers and similar. Uh, I will give my own story. Maybe that is something people will be able to understand and relate to a little bit more. So basically, I think I was 26 at the time, I went to get my wisdom teeth removed. I got a painkillers. Painkillers literally destroyed my stomach. I was gaslighted. No one would admit me to the hospital. They told me, "Oh, you're a young woman. Nothing is going on. You're imagining the pain." And after actually nagging the doctors to allow me to be examined, I made it to the hospital. I was told, now you wait and you will be the last one today that we will examine because you're the healthiest person in the room, because you're the youngest. And then when I was actually undergoing the endoscopy, I did it without anesthesia or anything, so quite hardcore. And finally, I hear the one thing no one ever wants to hear when they're lying in the hospital bed, and that is, oh, all the students come here. We've never seen something like this. That was fun. And then they say, oh, this young lady had 3 stomach ulcers. We've never seen an immune system so compromised. Yeah, long story short, the medicine I've been given has caused further problems and damage to my GI tract and so on. And now I've invested about more than 2 years of my life of just actively reversing all of that damage. I would say I reversed it, and there are still some things that I understand that my baseline is not the same as everyone else's, right? However, this year I decided to go. I was doing my blood biomarkers and so on, and I had an elevated cancer biomarker for gastric cancer. So, given my history, it was in, I wanted to do additional tests to see what is going on and whether there is something that I should be aware of. And I made it to the doctor, and I've done actually also the complete pill endoscopy to see my complete GI tract. And he said, absolutely everything is remarkable and perfect. There's nothing to worry about. And those biomarkers actually correlate, that they're looking for markers at the levels, the standards for people above the age of 50. So we don't know. We don't know. There's so much we don't know in terms of what should we compare young people to, because we've never seen such an incidence of cancers in young people as we do nowadays. In colorectal cancer specifically, there was just a study that came out very recently that it's in abnormal numbers on the rise in the young populations. And specifically, when we are looking, for example, at immunotherapy for cancer, specific types of, so specifically in colorectal cancer, only 1 in 20 people respond. So that's something like an underlying problem no one is talking about, that basically you go to the doctor and you have a condition. However, chances are only 5% that you will actually respond to the drug you will be given. And that can be specific. In general, on average, 50% of people don't respond to drugs. And, I don't think people are aware of that when you go to the doctor, that there is a significantly high chance that you would not even respond to the drug. And we don't yet know why that. Coming back to the previous topic of gut microbiome, we know that gut microbiome is related to that. It is an emerging field of understanding all of those different interactions between the gut, but not just the gut itself, but also just individual biology and all the other things related to a person. But specifically, there are certain species in the gut that have been identified, such as Bacterium plasmidi, which has been just among a wide range of indications that it's in and more abundant in people who do respond to drugs. And again, this is not very overgeneralizing it, but we can dive really deep into which conditions and so on. I see you're trying to say something for a while now.
So 2 things on that. When you say 50% are non-responders to drugs, so we said there's a certain indication that certain gut microbiome might help with response or not. Looking at the drugs, are there certain clusters of drugs where there are higher or lower response rates? Are we saying ibuprofen works on 90% of people, but this particular immunotherapy for cancer only works on 10% of people?
So yes, it's context dependent, right? So it's drug dependent, condition dependent. For example, on average in oncology, 70% of patients are non-responders. Now, even when we are talking about the response rates, there are again, it depends on what you look at. What is the response, right? Is it just about shrinking a tumor? Is it about actually eliminating the tumor? Those are 2 completely different things. So, in average, across all drugs, it's 50% of people don't respond. In oncology, 70%. In specific type, such as colorectal cancer immunotherapy, it's only 5% of people responding. we are not even talking about drug-to-drug interactions and similar, because ultimately, another thing that we should take into account when it comes to the aging population that are encountering such conditions, a great deal of people will already be taking certain kinds of drugs. And that's just something that we really need to start looking at the individual and their individual trajectory, and not just, this is a drug for this condition, and since you have a condition, this is the drug for you. That's the wrong way of thinking. It's more about, you're this individual, this is your baseline, this is your trajectory, this is what happened over time, and this is how we will address it. That's why at Ani we are building this algorithm and we are building these data sets. And now in January, we are launching the largest ever longitudinal longevity intervention trial. And we will be integrating various omics, so transcriptogenomics, metagenomics, to really be able to benchmark our digital biomarker against that as well, but also to understand on a really, really deep level. We'll be collecting more than 250 GB of data per person just for the initial set of analysis to understand what's going on.
Who's a good trial subject for that? Do you want people who have some sort of chronic condition? Do you want a mix of people?
Unfortunately, let's just talk numbers. 50% of people in the world suffer from a chronic condition. 50%. As I said, 1 in 10 Americans considers healthy. Yes, it's oriented towards, let's say, the general healthy population. However, I would argue that each one of us, just given the world we live in, and it's nothing personal really, have certain deviations. And it's ultimately about understanding all of those deviations across all the different biochemical profiles, So it's ultimately about gathering the largest and the most dense data set of people. The goal is to reach 1.7 million people up in the next 5 years. So we can actually determine what is a healthy state and how can we move towards a healthier state.
So hyper-personalization is key. Obviously, at this stage,
Exactly.
there's so much we don't know.
People often ask me, Nika, what kind of supplements should I take? Is this good for me? Oh, I was recommended this. Should I be on this diet, that diet? Ultimately, when you break it down, it's all about compounds. So it's all about different information. And it doesn't even have to be something we digest. It can be light, it can be sound, it can be different types of information we are surrounding ourselves with and taking into ourselves in a way on a daily level. And we just need to understand all of those different interactions. The more data we collect, the more data we know about each person, we can reach that stage, the sooner we can reach that stage of hyper-personalization.
So sticking with that, actually knowing what your baseline is, we previously said it'd be very good to find out particular baselines early on in life so that 10, 20, 30 years later, you can see what the changes are. This is something that is very, very prevalent in the current generations that are either going through menopause or will be going through menopause in the future. Obviously, the ones that have gone through already, not much help for them. But something I hear time and time again is, look, especially when going to HRT, hormone replacement therapy. So for those who don't know, basically in menopause, your ovaries shut down. They stop producing your sex hormones, at least to start with, in the quantities that they used to. And then basically goes down to very, very low quantities. There are all sorts of negative side effects of that, which we'll dig into in different episodes. But my point being, I hear time and time again, HRT is or needs to be very, very hyper-personalized. But in order to know what to give this lady, we kind of need to know what her baseline was 10, maybe even 20 years ago. So this is a very interesting parallel here.
Yeah, I would say, if only I knew or collected all of that data about myself at least 10 years ago. That would be amazing. Given this stage, and what we also connected with in person before was, as you mentioned, perimenopause, menopause, ovarian aging, it's a personal topic of interest. There are now interesting studies that came out about recognizing that could potentially delay ovarian aging, very new studies, experimental and so on. So I wouldn't advise anyone to now just go and take rapamycin for that. But it's definitely something that is interesting to explore further and to understand how exactly it works and why does it impact women in such a way. We don't know enough. Also, I don't think we are told early on in our lives as women to start preparing for this stage. I've experienced it on my own skin, and I have a network of women who experience it. Suddenly you reach 30, and then it's like, oh, now I should start thinking about this. However, we should have started thinking about this and managing it at least, I would argue, 10 years earlier, because that was the best time, right? And we are talking about egg freezing and similar. You start thinking about it in your 30s. What if we had started thinking about it earlier and just got the whole thing done when our bodies were in a more optimal state for that? Let's discuss that. And yeah, I don't think we are educating women enough about their reproductive health in a way that is about preserving the best of their eh, biology and understanding if we want to reach such a state, what is needed. And I think there's so much to be discussed here, so much that we should take into account, like even just the egg freezing methodology, which I'm not a fan of thinking like, oh, now we need to push 10 eggs out in one month. And then again, we are providing hormones and similar to kind of just kickstart the body into doing something that it would naturally not do. Are there smarter ways to do that? Are there better ways to do that? More efficient ways that are not so disruptive for a regular cycle? Are all topics where I'm really looking forward to seeing new innovations.
And actually, one point that you raised, which I found so interesting, you said, look, I wouldn't mind going to clinic. If I need 20 eggs, I'll go to the clinic once a month for 20 months in a row or whatever it's going to be and collect one egg at a time. And obviously with what we discussed with the current collection methods, that's actually not a good idea for various reasons. But when he said that, I'm like, actually, this is not a bad idea. So if anyone out there has ideas, please do get in touch. We would very much love to find out more.
A better collection method. Again, we are very used to, we can do invasive things to women. Simultaneously, we do not accept women experiencing pain, right? So if women are suffering from pain, it's just considered, oh, that's normal. So I think we just need smarter ways, more efficient way to do that. I'm certain if enough funding would go into that specific field, something very interesting would emerge.
So sticking with women, you previously mentioned there were some interesting statistics around autoimmune diseases in women specifically.
Yes, I think it's not even just statistics. I've seen it in my circle of friends, and I've heard from my friends about their friends. The rise of autoimmune conditions in women specifically. What I think the problem here is that we kind of at this point we just regard it as something very normal. I think ultimately that's the greatest problem, and it impacts the quality of life in such a significant manner. And again, coming back to the field of affective neuroimmunology, a person that is diagnosed with something even early on in their lives or earlier on in their lives, then goes on just also considering themselves a patient of a certain condition. And it's much harder once you accept it that this is your baseline, this is your standard now, to also reverse it, because a complete system is not really built around reversing it. It's more about managing a certain condition. I've personally, after this whole gut brain interaction disorder and so on, I had such an impact, drastic impact on my quality of life. I started suffering from migraines. I started suffering from joint pain. I could not leave my house when it was windy, when it was rainy. I felt I was, 27 or something. I felt like I was at least 50 years older than that. And I've gone through that. And I also remember from that perspective how much harder it was when you are in these mental patterns to, again, consider yourself as a healthy individual, or just consider yourself as someone who has all the ability to do all the things that healthy individuals do. And yeah, I think that's very limiting.
Let's work on that. Are you ready for the curveball questions?
Yeah.
Fantastic. So, what are 3 things that you wish that your colleagues, patients, the wider circle of people that you deal with and that you dress with knew that you think would really move the needle if they knew that and acted upon it?
I think we live in a world that is very comfortable. We live in a world where it's much easier to be a couch potato rather than have the discipline to wake up and, for example, just catch a little bit of sunlight. What I think the wider circle would need to be more aware of is just how many biohacking tools are already out there that are available to each and every one of us, and it's so easy to implement in our life with just a little bit of dedication, persistence, and discipline. So I think we don't emphasize enough this, let's say, more, again, intangible things like dedication, persistence, and small things you can implement. Just go for a walk every single day. Wake up and look at the sunlight and grab some sunlight. Even if it's not sunny outside, go outside. Everyone can run for 5 minutes. I'm not saying it must be something long, tedious. It doesn't have to be the perfect, 2-hour exercise regime every single morning. I don't do that. I don't think people have the time to do that anyway, in most cases. But simply set up a set of really small habits and stick to them, and that will dramatically change things.
Okay. And what is the book or are the books that you've gifted the most? And what are the books that have changed your life the most?
Well, there is one by Robin Sharma, 5 a.m. Club. I think it changed my life because, well, it was one of the things that brought me and my co-founder Bruno together. And we were reading the book together and we decided to wake up at 5 a.m. together. And that was just something about, texting each other saying, oh, I woke up at 5 a.m. Did you, even though you probably shouldn't use your phone so early in the morning, but it was about this having someone with you go through that. It dramatically changed my life because I no longer do that. I wake up now without an alarm clock, so it's not usually 5 a.m. But I think we were on it for, I believe, more than 18 months, very religiously. And it was also about this strength of willpower. If you really want to implement something, you can implement it. But yeah, books are beautiful and very inspiring to read. And I like to read books that also have this practical impact on my life and what I can do.
And what purchase of €100, dollars, pounds, or less has most positively impacted your life in the last 2 to 3 years or even in recent memory?
Well, I have a very recent memory. So I bought this, and it's not something you would expect, but it's a watercolor set. So you have watercolors inside, and I bought this postcard papers that are for watercolor painting. And basically, I just draw every single day. I only just started. So I started 3 days ago. So it was only 3 days in a row for now. But it's very little. I can carry it around me all the time. And it's challenging me to flex my creative muscle. And there at this moment, I realized now as I'm working a lot using the most recent reasoning models and so on, and I'm just waiting for the AI agent to come up with a solution. There's this moment when they are thinking. And while they are thinking, I have this nudge like, oh, now I can check my WhatsApp or check my email or, it's something more scrolling like, let's say. So I decided to integrate a very simple and easy thing that I can always grab from somewhere and just flex my creative muscle instead.
So this is really interesting from a brain chemistry point of view. So rather than doing something scrolling, i.e. the dopamine kick, the next thing, check your bank balance, check your stock portfolio, check the news, check your emails, check whatever it is, you're actually using something that's calming. So you're actually going more towards the serotonin rather than the dopamine to pick you up, as it were, to keep you happy. Super interesting. Any other purchases or any purchases have really changed your life of $1,000, pounds, euros, or less?
I'm a big believer in the Therabody belly wrap that have the infrared and warming and vibration integrated into it. It really helped me manage my HRV. So as you can see, I'm wearing a smart ring. It's ultra human in this case. But anyway, the Therabody wrap dramatically helped me increase my HRV. And I also use they have a small ball as well, vibration ball. I really love it for all flights, for example, to just keep the limbs going and everything. So it's about setting up this system of things that are easy to integrate. I'm traveling a lot. I have other things that I really love, but that I cannot bring with me. For example, I have a Bellicon trampoline. I would recommend for every single person out there to get a trampoline. And Bellicon is pretty much the best, but having a trampoline in your apartment, which I have back in Croatia, it just this feeling of, I have 15 minutes between meetings. What I'm going to do, get on that trampoline. It really gets all the stress out. Gets all the stress out, gets you so pumped up, and you can just continue. So trampoline, Therabody, definitely some of the things.
I actually have a trampoline at home myself, and I get specific days when I literally have like 8 hours of back-to-back calls, literally every half an hour. There's sort of one loo break in between and one to eat something. And if one of my meetings finishes 5 minutes early or someone says they're running 5 minutes late, I go on the trampoline, I put on my favorite songs, and I'm not ashamed to admit some of them are actually quite a lot of them are Disney songs. So I go on there and I jump for 5 minutes and I sing. And, when I come into the meeting, people are like, who are you?
Yeah, trampolines are the best.
So what is this vibration ball that you mentioned for flights?
I actually have it here if you want me to show it just a moment.
Yeah.
It's very simple. It looks like this. It gets you stopped at every single airport for certain. Mine is out of battery right now, but it just, you turn it on and basically it vibrates and that's what it does. I find it very helpful. I find it very calming. And I also have a special pillow for around the neck with a shiatsu thing. And so I told myself I will never tell anyone about this unless it works. And it helps me calm down. So you will see I'm all about really just calming down. I use a lot of different methods to calm down because I get so many different inputs throughout my day. Given the amount of things we're doing, we have more than 30 ongoing scientific projects at this moment in time. We are part of 7 large consortiums, majority financed by the Dutch government. We just recently also welcomed Eric Worden, the CEO of Bach Institute for Aging, as the president of our scientific advisory board. And there's a lot of input each and every day, also on the development of the technology. You must keep up. Every single day, something new is coming out. You must be able to also take a step back, look at what's obsolete now, given the state of technology in the world. How do we progress? Doing all the patents, which is usually all the legal and the strategy work is on me. So my day is really filled with so many different activities that I feel if I don't actively work on me actually being more relaxed, being more able to breathe, being more able to just let those information pass through and then navigate through that, it's not going to happen on its own.
I agree with you. So just coming back to the vibration ball. So this is something you use for vagal nerve, or how does it work?
Yeah, that is how it's supposed to work. I practically use it when you're on the plane. I either just put it like here, or I'm
Similar
with,
to, yeah.
yeah, I also put it on my shoulders. I put it, this will sound wrong, but I sit and it's maybe between my legs is not the best way to say it, but just like between my knees, yeah. And then it's like you feel it throughout your whole system as well. And it really helps with long flights. Um, I personally really think it's great. And I think having a great sleep mask is very important. I travel a lot, as you can imagine, and you go into a hotel, you cannot expect that everything will be on par with all of in all of your standards. You know, once you go into this deep dive, you kind of just either set up your life so you have this framework and you know that it works for you. So I got a silk sleep mask to help me out with that, and it has these nice, you know, like puffy stuff to protect the eyes. And another really recent thing that I started implementing are they're called loop. They are small things you put in the ear to just reduce the noise of the outside world. So when I'm in very loud spaces, I'm quite sensitive to just the world around me being very loud. I think the currency of the future ultimately is a combination of our personal energy and focus, because only if you focus your energy and your intention, you can actually get something done. And then if I'm in a loud setting, I really cannot get my level of focus. So I got the loop headphones, and it's not headphones. It's just like they reduce the volume. You put it in your ears. It's still quite new. I like them. That's my initial observation.
Brilliant. So I'm going to put links to all of these into the show notes. What is an unusual habit or an absurd thing that you love? I think we've got quite a few already, but if there's anything else you want to add?
Oh, absurd things I love. I think you've already seen my stack. That is quite, maybe it's not even the most usual biohacking stuff. So I don't think biohackers do watercolor. But yeah, one of the things is uh, shaking. So shaking is amazing. Again, connected to the trampoline. Even if you don't have a trampoline, I'm not very consistent with this, right? But when I do shake before going to bed for like 5 to 10 minutes, I even see drastic differences on my smart ring, like my heart rate and everything. And I feel well, the metrics say I sleep deeper, I sleep better. So I think there's this great importance of letting go of all of the input. We receive such a huge amount of inputs. Don't provide your body and your mind with more input afterward. You know, another Netflix show won't really help, but rather figure out ways how to reduce that noise and really focus on what is important to you.
The shaking is a really interesting one. I've used that time and time again as well. It basically works through somatic release. So it helps your, well, I suppose, reduce your cortisol, your stress hormones, and your other adrenal hormones through, I mean, essentially lying on the floor, you're inducing a shiver, not necessarily a cold-induced shiver, but something that you voluntarily, start to shiver, really, and then you keep that up for a couple of minutes. So definitely worth trying. Sounds weird, but definitely try. So final two
Mhm.
questions. What are you working on at the moment? I.e., what is the next exciting breakthrough you see coming? Obviously, we've touched on that quite a bit, but
My everyday at Ani is filled with exciting breakthroughs. As I said, more than 30 ongoing scientific projects. We have some really exciting stuff coming up next year that I cannot yet disclose, but do keep posted on it. And also the launch of the longevity intervention trial. I wake up to this feeling grateful to be in the position in which I'm in. You cannot imagine the number of operational problems coming up along the way. However, I'm really looking forward to this launch, and I'm really looking forward not just to the launch, but also everything that will follow. And that is all of that data analysis, and especially in the field of women's health, because there has not been such a study yet done in women. I am also particularly looking forward to launching sub-pilots of that project as well. Like when we identify a certain subset of the population where we would like to explore some specific patterns in more detail. So yeah, I'm just extremely grateful to be in the position to work with the world's leading scientists in the field, innovators. Our partners are really best in class, and I'm just there's so much to learn every single day. And I think that neuroplasticity and being open is very important.
For this study, how can people get in touch with you, both regarding partnerships but also enrolling as study subjects?
Then they can just go to our website, anibiome.ai. Right now, we have the waiting list for the upcoming trial. So it will be designed as an invite-only membership program, and they can just sign up there, and I would be happy to see what we can do.
Fantastic. And final question from me. Who would be a perfect sidekick in, I suppose it's not a lab in your question, but in your work? So this could be someone alive now or someone alive in the past. This could be someone real or imagined.
Well, when I started on this journey, I could not have imagined the kind of people I'm working with today. There is something that I've learned very early on that ultimately it is people's business and it's about the person to person contact. And when there's connection between the people and when that works, everything else can work. Without that, nothing can work. And I'm just really grateful to my co founder, Bruno, for his innovative spirit, his way of just picturing the vision and just really understanding how together, of course, that needs to then be implemented so we balance each other out in that sense. But also, I'm very grateful to have Eric Gordon with us. He's an outstanding person above everything and scientist. But, just very recently, we visited him at his house. We went for a hike, also with a lot of longevity physicians, actually. And it's those moments that also support our own longevity, right? And it's just amazing to be able to be here. And just recently, Mibna Angelic, she's a dual PhD in neuroscience from University of Maastricht and Milan. She joined us as the head of neuroscience at ANI. And we spend a lot of time together, given the multitude of scientific projects that we have and pioneering the field of affective neuroimmunology. And she's also an outstanding person. And we have so many great supporters from the investor circle and similar. I'm just grateful to have them with us. So if you tell me, which superstar do you want? I would say, I'm very happy with the circle we already have. Of course, we can always upgrade and go beyond, but I just wanted to express gratitude also for what we've built so far.
Fantastic. Nika, it was an absolute pleasure to have you on.
Likewise, Judith. And once more, so for the trial, it's all on the website. People can reach out to us, and I really look forward. And I would just like to emphasize one more time for our breast cancer program for early diagnostics. If there's anyone out there, any woman who has an increased risk for breast cancer or has gone through breast cancer or knows someone who's going through breast cancer or has clinics similar that are researchers in this field, we would be very, very happy to work and just reach out to me personally. I'll make sure that we get back to you as soon as possible. Thank you, Judith, for this opportunity to also spread the word about that.
Thanks, Nika. Thank you for joining me on this transformative journey. Your presence in this community is truly valued. Now, you may not realize it, but your words hold immense power. They have the ability to reach others who may benefit greatly from the wisdom shared here. If you found value in what you heard, I kindly ask you to take a moment to subscribe to Biohacking Eve, leave a glowing review on your preferred podcast platform, and share Biohacking Eve with your friends and family. Your support helps spread the message of health optimization for women far and wide. Lastly, I want to express my gratitude to you for investing in yourself. By prioritizing your well-being, you serve as an inspiration to others. I'm eagerly looking forward to bringing you many more exciting episodes, and thank you for being a part of our The Biohacking Eve Health Optimization for Women podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be substituted for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining medical advice for any medical condition they may have and should seek the assistance of the healthcare professionals for any such conditions. In addition, the information on this podcast does not constitute investment or financial advice.